Hello, my name is Ellen Brogan, and I would like to welcome you to the second webinar in a two-part webinar series on the application of ionizing radiation regulations in veterinary medicine. So, as this is the second webinar, I will first just give a brief recap of topics that we discussed last week, but the recording of last week's webinar will also be available on the EPA's website. So a link will be sent out when that is uploaded alongside tonight's presentation. So during the presentation, I will first give an overview of the enforcement policy. I will explain each of the policy's elements, so from the authorization process to guidance, and then onto compliance assurance, where I will look at a remote compliance assessment of the veterinary sector that was carried out last year. In compliance assessment, I will also look at the procedures that are involved in carrying out an inspection. And then finally, we will look at enforcement tools that are available to the EPA. After this, I will go on to explain some of the basics of Eden, which is our online data exchange portal. So we'll look at accessing Eden, amending your authorization, how to do this, and then also how to respond to inspection findings. So last week I discussed the risk-based approach, which underlines the EPA's regulatory approach towards the use of ionizing radiation. So regulatory control is really intended to ensure that the risks associated with a radiological practice are effectively managed on an ongoing basis. So the risk-based approach means the greatest regulatory effort is directed towards higher risk activities. And this really informs each of the four elements of the regulatory system as illustrated on this slide. So you have the authorization, so in other words, the certificate of registration or the license, which lays out the conditions for safe use of X-ray equipment. And all practices involving the use of ionizing radiation must be authorized by the EPA. Then you have guidance documents and webinars, which aim to provide support to veterinary practitioners and others in understanding and complying with the legal requirements of the ionizing radiation regulations, your authorization conditions, and the veterinary code of practice. We also have compliance assessments. So these are, in other words, mostly inspections, and we use these to verify compliance. And then finally, we have enforcement, which is the final option available if compliance cannot be gained by any other means. So remember from last time, the ionizing radiation regulations, or IOR 19, they introduced several important changes to the way in which the EPA regulates, such as the introduction of a risk-based approach to the issuing of authorizations. So this approach was termed graded authorization, and it really split the authorizations into regulation and registrations and licenses. So the risk associated with an authorization is related to the practices undertaken in the veterinary clinic, and a full list can be found using the QR code on the slide here. Registered practices are practices which are deemed to be a lower risk, and this only includes general veterinary radiography carried out in a risk-assessed veterinary clinic. Licensable practices then, these are deemed to be a higher risk and include, for example, general veterinary radiography performed in the field. So off-site examinations are licensed, and this is because they carry additional risks which relate to increased difficulty to control the site and to implement protective measures. So all practices which are relevant to your veterinary clinic, they must all be listed on your authorization. So if you carry out both a registered practice and a licensed practice, then the higher form of authorization will apply. So in other words, you will have a license. And this license will list both the registered and licensable practices. So irrespective of the form of authorization, all undertakings carrying out a radiological practice, they must fully comply with the relevant provisions of IOR 19, the Veterinary Code of Practice, and any conditions that are attached to their license or registration. All authorization holders, they can be subject to compliance assessments, including an inspection by the EPA. So in webinar 1, I went through the new legislative requirements that have come into force with the adoption of IOR 19. So I spoke about the practices which define if you have a license or registration. And then I spoke about registration. So registration is authorized indefinitely, whereas a license, it will be need to be renewed after 10 years. Then for equipment, a registration holder must keep an inventory list on file, whereas a licensee, they need to upload this to Eden. And this is also true for the requirements for naming your radiation protection officer and your radiation protection advisor. So this will be retained on file for registrants and on Eden for licensees. Both must complete a risk assessment before any new equipment is brought into the clinic, but licensees must also update the risk assessment periodically and maintain that up to date. And radiation safety procedures, they're not required for registrants. So the code of practice on the application of ionizing radiation regulations in veterinary medicine is generally sufficient, but licensees, they must create their own local radiation safety procedures, which are in line with the risk assessment. And then this slide is just to give some definitions on the statutory roles from IOR 19. So these are roles that are legally required to be filled under IOR 19. So I will be mentioning these roles throughout the presentation. And I went into greater detail on this last week, but just to summarize for anyone new, the undertaking, they are a natural or legal person with legal responsibilities for carrying out the radiological practice. So this is usually, but not always, the veterinary practitioner in charge. And the undertaking really is just the person with the primary legal responsibility for compliance with the regulations. Then you have the radiation protection officer. So these are an individual, or they can be a team, designated by the undertaking to implement the radiation protection arrangements within the clinic. So this is usually, but not always, a veterinary practitioner or nurse. But if you are a sole business owner, you are then both the undertaking and the radiation protection officer. The radiation protection officer, they must have sufficient knowledge, authority, time and resources to carry out the function and also have a reasonable level of standing within the clinic. So the RPO function is now one part of these statutory roles. It wasn't before. And so they must be named on Schedule 3 of the license. And the radiation protection advisor, they are an individual, or they're a body that meets the competency requirements that we have set out to provide radiation protection advice, and whose name also appears on the RPA register, which is maintained by us, the EPA. And the radiation protection advisor, they are external consultant role. They also must be named on Schedule 3 of the license. So depending on the practices carried out in the clinic, you will have a registration or a license, which is shown on slide. And in order to obtain a registration, the undertaking or veterinary practitioner, they must complete a self-declaration form through the application process in Eden. And to prove they are compliant with IOR 19, undertakings which hold a registration must retain all of these documents on file to support that self-declaration. A certificate of registration is issued through Eden when the application for a registration is completed. And then to obtain a license, the undertaking, they must submit an application through Eden as well, but the information to be provided for an application for a license, this includes a list of all the practices that you wish to get a license for, the legal details of the undertaking, the address of the undertaking, and of the premises at which the radiology will be carried out. And then Also a complete schedule of equipment, which will be put up on Eden, and then relevant personnel details, including RPO and RPA names. So in support of the license application, there will also be documentation which must be uploaded. So for example, the risk assessment or the radiation safety procedures, agreed arrangements with the radiation protection advisor, etc. So all of this information and documentation must also be, all this information must also be submitted for any subsequent amendments to the license or during the license renewal process, which happens every 10 years. Again, if you have the registered and licensed practices within your clinic, you will only have a license, and the registered practices, they will be listed on the license, and therefore you will need to fulfill the requirements of a license. So for registration, there is a €300 once-off authorization fee, and then you have no annual enforcement fees. The registration is indefinite, so it's authorized indefinitely unless you surrender or it is revoked. You do not need to submit the equipment inventory or documentations, but these must be retained locally. You only need to amend the registration if you wish to apply for authorization of a new practice not currently covered by the registration. And this will mean that you're actually applying for a license because there is only one registerable practice for veterinary. And then also you can submit an amendment if you want to update the legal entity or the address. So as already mentioned, the registration, applying for registration, this involves a self-declaration form as seen on this slide. So before submitting the self-declaration form and applying for registration, it is absolutely essential that you must have all of these items, which are referred to in the form, in place before you start the application. An incorrect self-declaration form, this is a prosecutable offence. So the self-declaration form states that registrants have completed a risk assessment. They have protective measures in place that were identified in the risk assessment. They have consulted with a radiation protection advisor. They have designated a radiation protection officer. There is an appropriate training policy and training implementation in place. And just a note, training should be given before commencing any work with ionizing radiation. The self-declaration form also states that registrants have classified any areas which were indicated in the risk assessment, and that they have an incident and accident procedures. So by checking these boxes, you have legally declared that you have all the necessary documentation retained as evidence for all of these sections of the self-declaration form. So if you provide false and misleading information, this is one of the factors that the EPA will consider in determining enforcement action. And this can range from inspections to the revocation of a certificate of registration. And you cannot get a registration if you have not submitted this form and therefore declared that you have all of this in place. And then moving on to a license. So there is a €1,000 once-off authorization fee and then €528 annual enforcement fees. But veterinary nuclear medicine and veterinary radiotherapy, they have slightly different fees. And then you have a 10-year duration of the license, and then it will need to be renewed, which will be €250. And the application is to be reviewed by an inspector. And again, you must submit details of premises, personnel, equipment inventory, risk assessments, radiation safety procedures, etc. You need to amend a license then if you wish to apply for an authorization of a new practice, update this equipment inventory, update your radiation protection officer, radiation protection advisor, and then update any information about the legal entity or the address of the clinic. So the authorization and authorization conditions, these are the first elements in our risk-based approach to regulation, as explained in the earlier slide. But alongside this, the agency publishes guidance documents to support compliance. So we publish clear guidance outlining what we expect from those we regulate. We aim to support compliance within the regulated community by being clear about what is expected from them in terms of legal requirements and compliance, and then what they should also expect from us in terms of regulatory oversight. So we began this webinar series with the aim to give further training, really detailing the obligations of undertakings, radiation protection officers, and other relevant staff under IOR 19. And the webinar series was really created there to provide guidance on the practical implementation of authorization conditions and statutory requirements. So the webinars hopefully will also act as a mechanism for feedback and engagement through Q&A sessions. So last week I also discussed authorization conditions, IOR 19 risk assessments, radiation safety procedures, etc., and what the legal obligations for all of these are for a registration versus a license holder. So the recording, as I said, will be made available on the EPA website. It's not currently published, but you will get a notification when it is. And then the code of practice on the application of ionizing radiation regulations in veterinary medicine, which I will refer to as the vet code of practice. This really sets out in an easy to read format what the veterinary sector must do to comply with the legal requirements of IOR 19. And the code of practice is a legally binding document. So what this really means is the requirements contained in the code are legally enforceable. So then the EPA, as part of its regulatory function, also issued the IOR 19 guidance for undertaking as well. And that really sets out what compliance looks like for all sectors and gives further advice on how to comply with IOR 19, but it is not specific for the veterinary sector. Compliance assessment, then, by the EPA, it is another key element of the system of regulation. So in accordance with IOR 19, the EPA routinely assesses whether those authorized to use ionizing radiation are compliant with the regulations, any conditions associated with their authorization, and the veterinary code of practice. So we really inspect sites that we regulate on a regular basis, using a risk-based approach to focus on poorly performing or high-risk activities. And then we will publish our inspection reports. So as authorized inspectors within the Radiation Protection Regulation Unit of the EPA, we are authorized under the Radiological Protection Act 1991 to enter any premises for the purposes of an inspection. So the EPA's objective is really to protect workers and the public and maintain confidence in regulation by promoting a culture of safety and security, particularly in the management of radioactive equipment, and by engaging with authorization holders and collaborating with relevant national and international authorities to really promote and achieve compliance. So regulatory control, it's intended to ensure that the risks associated with radiological practice are effectively managed on an ongoing basis. So compliance can really be assessed in a number of ways. So firstly, we have the surveys, the self-assessment questionnaires, the audits of documentation, and the EPA may issue questionnaires to undertakings for them to complete and return within a specified period. So an inspector may then also follow up with on-site inspections. But these surveys, they can include sectoral surveys. So for example, the survey that was sent out to authorization holders in the veterinary sector in 2022, which I will discuss in more detail on the next slide. And then when applying for registration, you have the self-declaration form, and this information can be verified by an inspector at any time. So the registrant would then be required to produce relevant documentation, which would be then audited by an inspector when requested. Secondly, we also have review of safety documentation. So again, the EPA may at any time request copies of current risk assessments, radiation safety procedures, evidence of appropriate installation of X-ray equipment, or evidence of acceptance testing of X-ray equipment, or any other relevant documentation. And this is really for the purpose of reviewing that documentation's adequacy. And then thirdly, we have inspections. So an EPA inspector may carry out site inspections to verify compliance. So the inspection may be announced or unannounced, and it will include interviews and discussions with management and staff. It will also include the observation of radiation protection in practice and an examination of documentation and records. So inspections are based on an annual inspection program, which focuses on poorly performing and high-risk activities. The inspection program is really designed to ensure that licensees where there is a greater radiological risk are inspected most frequently. So these inspections, they can be planned within our annual program or reactive if a concern is raised. So inspection procedures are also accredited by the Irish National Accreditation Board to ISO 17020 2012 standard. And the EPA will issue an inspection report to the undertaking through Eden within 28 working days after the site visit is completed. And then finally, we also have remote compliance assessments for compliance assurance. And the EPA may from time to time perform these remote compliance assessments, and they may be followed up with a site inspection where particular issues or concerns are identified. And remote compliance assessments will now only likely be performed in exceptional circumstances. So more recently, the EPA has started really to focus on carrying out these online compliance surveys to really focus in and verify overall compliance of a specific sector. So in July 2022, the Radiation Protection Regulation team, they carried out an online compliance assessment, which is known from here on out as the VET survey. And this was to assess the level of compliance against IR 19 authorization conditions and the veterinary code of practice within the veterinary sector, and really try and identify areas that were of particular issues or challenges. So the participants, which were both licensees and registrants in the survey, they were randomly chosen for one per county in order to answer the survey, and their responses were considered mandatory. So while this compliance assessment was not carried out in person by an EPA inspector, it carried the same regulatory weight as an on-site inspection. So the survey had different questions for licensees and registrants that were based on an analysis of findings of site visit reports in the veterinary sector from the past year. So in total, 36 questions for licensees and 30 questions for registrants were created and divided into 9 sections. So you had the risk assessment, categorization of workers and dosimetry for exposed workers, radiation safety procedures, governance and responsibilities, which included radiation protection officer and radiation protection advisor arrangements. You had a radiation protection training section, personal protective equipment, X-ray equipment inventory, and then also the maintenance of X-ray equipment, and then finally quality assurance. And 10 documents were requested throughout the survey, which related to these 9 sections that are listed here on the slide. And these documents were requested as evidence to support the answers that went with the questions. So from the original 61 emails that were sent out, 56 were actually delivered to authorization holders. So this was due to some emails that bounced or there was changes in clinics. So from that, a total of 34 licensees and 22 registrants received the email with the link to complete the survey. And we initially gave 1 month to complete the survey. However, there was very small participation and low completion rates, so deadline extensions were necessary. And the survey was closed then after giving the participants, so both licensees and registrants, a total of 2.5 months to complete the survey. And in the end, a total of 22 out of the 34 licensees and 16 out of the 22 registrants who initially received the email with the link for the survey submitted and completed responses to the survey. So this meant that only 68% of authorization holders who received the email link submitted responses to the agency after 2 months. And the veterinary survey, this held the same regulatory weight as an on-site inspection, so non-respondents were really considered to be non-compliant. And it is really disappointing to note that licensees who hold the higher authorization for greater risk practices, they actually had a lower response rate to the survey of 65%. Where you compare them to registrants who had a response rate of 73%. And the high response rate in registrants compared to licensees is shown on the graph there. So you can see that the smaller gap between the green and blue on the left-hand column for registrants shows that there was less of a difference between total surveys and the ones that were responded, whereas there was a greater difference between the total number of surveys and the ones that were responded to for licensees on the right. And this was really a great concern because, again, the greater risks associated with the practices that are carried out by licensees. So this was the first online survey that was carried out by the EPA within the veterinary sector since the introduction of IOR 19 and the publication of the Vet Code. So the responses were then recorded from participants and results from the survey. We were really able to identify any particular issues or challenges that were in need of guidance and improvement. So as you can see from the graphs on the slides, the bars that have a higher percentage of either red or purple are bars that are identified as problematic areas. So compliance with the requirements for risk assessments, radiation safety procedures, radiation safety training, and testing of personal protective equipment. These were particularly low, so they were among the problem areas that were identified by the survey. And the first question of the survey required the participants to select the type of authorization they have. So the first question asked them to choose between a license and a registration. So it's really worth mentioning that 4 registrants actually mark themselves as a licensee and 1 licensee actually marked themselves as a registrant. But this has been factored into the outcome of the survey. So looking at each compliance category now just in more detail. Firstly, the risk assessment. So just to reiterate, the purpose of a risk assessment is to identify the protective measures which are necessary to reduce exposure to radiation before carrying out a practice. And the risk assessment, it must be carried out in consultation with an EPA-approved radiation protection advisor. So approximately half of the licensees and almost 94% of registrants either submitted an unsatisfactory risk assessment or did not submit one at all. And then almost a quarter of the licensees had good risk assessments, but no good risk assessments were seen from registrants. And this finding is quite serious because in order to obtain a registration, the veterinary practitioner must self-declare that they've completed that risk assessment in consultation with a radiation protection advisor, which again potentially calls into question the validity of the responses from the self-declaration form submitted by these registrants. And the participants, both licensees and registrants, were given the option to explain why they didn't have a risk assessment. And among the main reasons given by them was a difficulty in finding a radiation protection advisor. And then it's really apparent the lack of consultation with the radiation protection advisor, just in terms of the quality of the risk assessment submitted. So among the issues identified was no categorization of workers. There was no dose monitoring. There was no risk rating in the risk assessment. The risks weren't properly assessed. There was no training requirements in the risk assessment, etc. And then for dose records, so personal dosimeters must be provided by the undertaking when it's indicated by the risk assessment. But the type of dosimeter and the instructions for its use, they'll be determined in consultation with the radiation protection advisor in conjunction with the risk assessment. So around half of both licensees and registrants said that the risk assessment had identified a need for dosimetry. And then approximately 90% of these then said they had dosimetry in place for exposed workers. I mean, but as seen in the previous slide, the majority of risk assessments had issues, and one of these was the categorization of workers and the need for dosimetry. So therefore, the presence of good dosimetry records for all correctly categorized staff is not fully clear. So it is also worth mentioning that registration is granted to undertakings considered to have a relatively low risk practices, and therefore the likelihood of these practices having categorized workers is very low. And so in theory, registrants are not usually expected to have dosimetry in place, but again, a consultation with a radiation protection advisor and a risk assessment will make that more clear. So approximately 70% of the most recent dose records submitted by licensees and registrants were either good or satisfactory. And we considered them to be good when they showed actual doses, but satisfactory if they did not show an actual dose, just provided some kind of mark, a star, for dose records that were below a minimal reportable dose, but didn't show the actual value. And then dose records that were considered to be unsatisfactory, so in the red there, they came from dosimetry providers that were no longer approved to operate in Ireland. So I just have a QR code there on the slide for all of the EPA approved dosimetry services. Um, so the categorization of workers, which shall be done in consultation with a radiation protection advisor, was not captured in the risk assessments. And it is well known that those working with radiation can tend to wear dose badges for comfort and reassurance purposes. But it's worth noting that undertakings did not seem to be entirely aware that this is a requirement only for categorized workers. So not all workers require dosimetry monitoring. That's something that just came up from this survey. So then we looked at the provision of the veterinary code of practice to staff. So licensees and registrants must make a copy of the code of practice available to any staff who are involved with the work with radiation no later than 28 days after an authorization is given, or if it's a new staff where you already have an authorization before they start work with ionizing radiation, they must be given the veterinary code of practice. An assigned record must be kept of the date on which the veterinary code of practice is made available to each of the relevant employees. So initially, the survey participants, they were asked if all staff who are directly involved in work with ionizing radiation have been provided with a copy and a record maintained of the date provided. Then following on from this, it was asked them to upload this record. And so this is the results of the records. So the records were considered to be good when it had the name of the employee, their position, the date that the vet code of practice was given, and a signature. So only 5% of licensees provided what is considered to be good, and 13% of registrants provided a good record. But the majority of both licensees and registrants didn't submit any record of this provision at all. And the main reason is because they said they were unaware of this requirement. And then moving on to radiation safety procedures for staff and whether or not a copy of they could submit a copy of these documents. And these documents were only requested from licensees. So in addition to the veterinary code of practice, local radiation safety procedures must be prepared in consultation with a radiation protection advisor. Um, Large animal x-rays or x-rays off-site would often fall into this category. So licensees must ensure that these radiation safety procedures are in place and available to all staff involved in radiological practices. So firstly, it was asked if the participants had a record available of the provision of the radiation safety procedures to workers and other concerned people. So this is the column on the left-hand side of the graph. So approximately 50% of licensees didn't have a record of provision. And then they were required to upload a copy of their radiation safety procedures, which is the column to the right. And 41% of licensees submitted either satisfactory or unsatisfactory radiation safety procedures. So these either didn't have a signature, or they were outdated, or they didn't take into account the risk assessment, or they didn't set out necessary operational measures to protect staff. And then 27% of licensees didn't have or didn't upload a copy at all. And it's important to note as well, several licensees uploaded the risk assessment here. But the risk assessment and the radiation safety procedures, these are two different documents. So then moving on to the radiation protection officer. The radiation protection officer must be designated by the undertaking to supervise or implement the radiation protection arrangements. So initially it was asked for the participants if they had assigned an RPO. And so 80% of licensees had assigned the RPO. And if the RPO name given in the survey was the same as the RPO name that's listed on their license, this was considered to be a good response. But then RPOs which were considered to be satisfactory were those which the name given in the survey was different from the license, or the license didn't have the name of the RPO at all on it. And then 75% of the registrants had appointed an RPO, while 25% of them hadn't. And the ones who hadn't appointed the RPO, again, said they were unaware of this requirement. Then moving on to the radiation protection advisor. So an RPA is a qualified expert approved by the EPA to provide radiological protection advice. And initially it was asked if the participants had consulted with a RPA, and then which RPA they had consulted with. So 23% of licensees haven't consulted with an RPA. And when asked why, most of them said they were having difficulties in finding an RPA. So I mentioned this last week, but there is a list of RPAs who have confirmed their availability for the veterinary sector on this slide. And contact details, etc., can be found using this QR code link, or searching the EPA RPA register. Approximately 14% of the licensees surveyed gave the name of the RPA that is appointed on their license, while 64% of the RPA names given were different or not represented on the license, and therefore were considered satisfactory. Moving on to the registrants then, 75% of them haven't consulted with an RPA. Again, to obtain a registration, an undertaking must self-declare that they have completed a risk assessment in consultation with a radiation protection advisor. Again, which brings up concern of a false declaration made by registrants when completing responses to the self-declaration form. Then agreed arrangements with the RPA. So licensees are then required to sign agreed arrangements with the radiation protection advisor, detailing the nature of the service provided, and just retain this documentation as evidence of the agreed arrangements. So these arrangements, they must specify the areas of RPA competencies, the radiological practices which are on the authorization, the scope of the advice that the RPA will provide, and the sites covered. So initially it was asked if the licensees have agreed arrangements in place with an RPA, and then they were required to upload this copy of the agreements. So the majority of them, around 55%, said that they don't have agreed arrangements in place with an RPA. and only 18% of agreements fulfilled all requirements, which are of Regulation 33, which are listed on the slide. And then moving on to radiation records of radiation safety training. So this is for both licensees and registrants. Staff must be given adequate radiation protection training before starting work with X-rays, and they must also be given periodic refresher training in accordance with Section 8 of the Veterinary Code of Practice. Regular and appropriate radiation training is really essential to effectively manage and minimize risks associated with the use of ionizing radiation. RPOs must also receive additional training to allow them to effectively carry out their role. Initially, it was asked of the surveyed how often training is being provided to staff working with radiation, and the majority of licensees, so just over 50%, said that training is being provided every year, where for registrants, they said they tend to provide training to staff every 5 years. So while the majority of licensees said that they provided additional training to RPOs, the majority of registrants said they do not. So a record of any training, including the date of training, the names of attendees, um, the names of the person who provided the training, and the topics covered. This documentation must be maintained by the undertaking and be accessible as required by the EPA. So records of radiation safety training were requested, but the majority of licensees and registrants didn't provide any records. So even though they had stated in the previous question that this training is provided, some respondents did mention that training had been provided, but on an informal basis, so they did not keep records, but records must be kept as documented evidence. And then personal protective equipment and the test of personal protective equipment. So protective equipment, so this is like your lead aprons, gloves, they must be worn when it is indicated by the risk assessment. And when they are not in use, they should be hung up without folds on appropriate hangers to preserve their integrity. So licensees and registrants, they were first asked to upload a picture of their PPE as evidence that they had basically the capacity to provide PPE to staff when needed. And overall, most of the pictures that were uploaded were considered to be good or satisfactory, and those are the two columns to the left of the graph. And then personal protective devices, they must also be radiographically examined every 12 months to ensure that the shielding efficacy of the lead PPE has not become impaired by cracks or any penetrations in the material. And this is a requirement as per the Veterinary Code of Practice. And so records of these radiographic tests, they must be kept on file by the undertaking. But approximately 65% of licensees and 75% of registrants didn't provide any such records. So these are the two columns on the right of the slide. And most licensees said that they do test the PPE, but they don't keep any records of this, while registrants mentioned that they were unaware that such a practice was necessary. And then moving on to X-ray inventory. So as per Section 10 of the Veterinary Code of Practice, details of the X-ray equipment, including date of acquisition, make and model of the X-ray, serial number of the X-ray, or any other unique identifiers. These details should be kept up to 2 years after disposal of the equipment. And licensees are required to maintain this inventory on Eden, but registrants are required to keep this on file themselves. And it was asked in the survey if the participants had an up-to-date X-ray equipment inventory available, and then records of the inventory were then required to be uploaded. So approximately 77% of licensees and 69% of registrants provided either good or satisfactory records of X-ray inventory, but 23% of licensees and 31% of registrants didn't provide any records. And the main reason being that they were unaware of this requirement to maintain records. And X-ray maintenance. Again, as per Section 5 of the Veterinary Code of Practice, the X-ray equipment shall be maintained in good working condition and maintained in accordance with the manufacturer's instructions. So initially it was asked how often the X-ray equipment are serviced, and then it was asked for a copy of the most recent survey service or maintenance records. So the vast majority of licensees and registrants mentioned that their authorized X-ray equipment is serviced at regular intervals of 12 months. And most of the records provided by licensees or registrants were considered to be good. But 36% of licensees and 31% of registrants provided satisfactory or unsatisfactory records. And these were considered to be outdated or that they were just simply an invoice of the service provided by the maintenance company. Now, moving on, so the inspection process, it's carried out by the Radiological Protection Regulation team, and it is accredited and is in line with the requirements set out in the National Accreditation Board. The objective of the inspections is firstly to ensure that the safety of workers and members of the public through an assessment of compliance with both the legislative requirements as set out in IOR 19, the conditions of authorization, and the VET Code of Practice. Secondly, inspectors aim to assess how radiation protection arrangements are implemented in practice and assess organizational culture and commitment to radiation protection. So inspections aim to encourage licensees or registered persons to achieve improved standards of radiation protection and promote good practice. These site visits also provide an opportunity for licensees to raise any issues with the team. So the Radiation Protection Regulation team, they plan and undertake their inspections under the annual inspection activities program, which may include planned or unannounced inspections, inspections undertaken as a result of complaints received, and inspections arising from incidents. We inspect sites that we regulate on a regular basis using the risk-based approach to focus on poorly performing and high-risk activities. So the powers of inspectors. The radiation protection inspectors are appointed under Section 28 of the Radiological Protection Act 1991, and the powers of inspectors are given in Section 29 of this Act. So these cover the measures that an inspector may take either for the purpose of assessing compliance with the Act or any regulation made under the Act, or for the purpose of preventing or alleviating the escalation of danger. Inspectors have the power to enter premises used during the announced or unannounced inspectors. And they also have the power to inspect X-ray equipment and radioactive sources, require the production of documentation, take copies or extracts of documents. They also have the power to require a person to give reasonable information for the purposes of assessing compliance. And they also have the power to take with them a member of An Garda Síochána, but this is exceptional circumstances. If, for example, if you were being refused entry to a premises. So to verify if authorization holders are compliant with IOR 19, the EPA routinely performs on-site inspections and review of safety documentation. So inspections are divided into two parts. You have the administrative details, which include a review of all documentation relating to the EPA registration or license, personal dosimetry, disposals, acquisitions, quality assurance testing, training, etc. And then secondly, you have the auditing of equipment or facilities, which includes a visual examination of authorized items and protective equipment, including radiation shielding where relevant, where it is outlined in the risk assessment, and then also an inspection of storage and security arrangements for handheld and mobile X-ray units. So announced inspections, that means an email notification will be sent out of the planned date of inspection, But with an unannounced inspection, you will get no notification, but inspectors still have the power to enter a premises for the purposes of an inspection. Remote compliance was common during COVID, but it's much more rare now and will likely only happen in exceptional circumstances. So in-person inspections, the inspector will assess compliance on site, and this typically takes around 1.5 to 3 hours, depending on the practices which are carried out and if documentation was requested and received before the inspection date. So at least one member of staff from the veterinary clinic is required to be present at all times during the inspection, and does not have to be the same person for the full duration, but the inspectors require assistance from a staff member at all times to access facilities and records. So the radiation protection officer is required to attend, but if that is not possible to arrange, the inspection can still continue with any staff member that are involved with the taking of x-rays. And if possible, we also request that you please work with an EPA inspector to arrange the inspector being able to see an x-ray performed off-site in the field for relevant licensees. And this is to allow for inspectors to review the operational processes. And where off-site work is never really carried out, a request will also be made by the inspector to see an x-ray performed in the veterinary clinic. So the inspection process then, and this will start if it's announced, as I said, with the inspector reviewing any documentation that has been requested and received. And this will be in advance of the inspection date. All documentation and records must be retained as evidence of compliance with the regulations, the code of practice, and the authorization conditions. So once arrived at the veterinary clinic, the inspector will start with an entrance meeting where the outline and the purpose of the inspection will be explained. So the veterinary practitioner or the RPO, which might be the same person, they are expected to attend this meeting, but other arrangements can be made. Then there will be a general review of administrative aspects of the license and issuing. So these can be issues arising from the documentation review that was done, or these can be issues that have come up from previous compliance assessments. A review of records will then be dependent really on the scope of inspection, but will likely include the risk assessment, the installation, acceptance, and quality assurance reports for the X-ray equipment, the radiation safety procedures, the dosimetry records, if relevant, the equipment servicing records, and importantly, the training records. Next, then, you will have the walk around, which will include an inspection of some or all of the locations where the license items are used and stored. And then, ideally, the inspector will observe an X-ray examination. We would ask that you work with the inspector to facilitate this. Inspectors are also interested, though, to just meet staff on the ground and discuss how operational radiation protection is carried out in practice. And then finally, the inspection will close with an exit meeting. And at this exit meeting, a verbal summary of findings to be included in the inspection report will be given to any of the attendees. So an inspection report will be made then available following the inspection. So the inspection report template can be seen on the slide. So the front cover will give details of the authorised body. So in other words, the clinic gives details about when the inspection report was issued and by who, and then just general information about the inspection. Within their inspection report, there will first be a brief summary of key findings, a list of areas inspected, and a list of documents inspected. And then following this, each of the findings from the site visit or the inspection will be listed, and each finding will have its own light grey box with a title for the findings, and then the finding reference number, which just helps us keep track. Details of the observation. So this is in other words, what the compliance observation during the inspection. And then finally, uh, the action, so the measures that the EPA is requesting the licensee or registrant to take in order to demonstrate compliance. Um, each finding and its corresponding action must be responded to individually via EDEN, which I will explain shortly, in order for the agency to get evidence of these corrective actions being taken. So the inspection reports will now also be available online at the EPA's License and Enforcement Access Portal, which is also known as LEAP Online, as well as being issued to the licensee or registrant. LEAP Online is really a means for the EPA of providing public access to enforcement information and to the formal regulatory correspondence that is exchanged between the EPA and licensees or registrants. Just go into some more detail on this. The diagram on the slide just really helps you understand the inspection report and the LEAP online publication process. So if we start from the left of the diagram, as previously mentioned, the inspector may review documentation prior to the inspection. And then, so the red box then denotes the day of the inspection at the veterinary clinic or in the field. From the day of the inspection, the inspector has up to 28 working days to issue the inspection report to the licensee or registrant. And the inspection report will be made available to you, the licensee or registrant, via EDEN. So the report may be sent earlier than the 28 days, but the day that the report is sent to you is the day that the next 30 calendar days of the next section begins. So this 30 days refers to the time when the report has been issued to the licensee or registrant, but has not yet been published to LEAP Online. So within the first 21 days of this, so that's the blue bubble you can see, the licensee or registrant can be sure that any of their responses they submit via EDEN to the inspection findings will be published alongside the inspection report after the 30 days. And then from day 21 until day 30, which is this green bubble here with the arrow, there is no guarantee that the responses to the findings will be published alongside the inspection report on LEAP. So 30 calendar days after the inspection report is issued to the licensee or registrant through EDEN, the inspection report will be published to LEAP Online. And the report will be published simultaneously alongside any responses to findings that were received within this first 21 days. When a licensee or registrant responses to the findings are not published on this day, they are considered still open. And so after this 30 days, once a finding response has been received and responded to by the inspector, it will be published on LEAP Online the day after. So, what are some typical inspection findings? The first is a lack of clear governance arrangements or responsibilities are not defined. So within the radiation safety procedures, the role of the RPO and other staff must be clearly stated. Inadequate risk assessments. The risk assessment should really be produced in consultation with an RPA. The radiation safety procedures, they're not reviewed, updated, or provided to staff. And radiation safety procedures, they must be reviewed periodically, or if there are any changes to staff, location, workloads, equipment, or anything else which may affect radiation safety. And the review is to really ensure that these radiation safety procedures are up to date. You have operational practices not matching radiation safety procedures. So the RPO should really perform routine audits where the operational practices of staff are observed and checked against the documented procedures. And this does not really need to be a lengthy process. The idea is really just to confirm if what is written in the radiation safety procedures is what's happening in practice and adjustments made then. The quality assurance program is not documented or implemented. So I spoke about the checks which are required annually for X-ray equipment, and the details of these checks and frequencies is detailed in Table 2 in Section 5 of the Veterinary Code of Practice. No evidence of equipment, services, maintenance, calibration, and documented evidence must be retained on file, and evidence should be more than an invoice. Signage issues, these can be missing or inappropriate. The signage requirements will really be determined by the risk assessment, but signs should be placed on the entrance doors to the X-ray exam room, or portable signs are typically required for large animal or off-site examinations. License inaccuracies relates to incorrectly named RPO or RPA, or that incorrect equipment or premises are listed. Records not maintained. So record retention periods can be found in Section 10 of the Veterinary Code of Practice. And staff not adequately training. So staff must go through training before commencing work with X-rays, or at least 28 days after an authorization is granted to the clinic. Staff must be trained every 3 to 5 years, and RPOs must receive additional training. And this can all be facilitated by the Radiation Protection Advisor. So this pyramid then just represents the general hierarchy of enforcement tools available under IOR 19. So the EPA really aims to work collaborator with those of you in the veterinary sector who use X-rays and other forms of ionizing radiation to promote a culture of compliance with IOR 19. But sometimes it may be necessary to take further action to enforce IOR 19. So the EPA will first look to bring a return to compliance through reports of inspection findings or warning letters. But inspectors do have a number of enforcement tools available to them. In more serious cases or in situations of continued non-compliance, inspectors will issue an amendment of an authorization to restrict the use of an X-ray or issue a direction, for example, requiring the taking of X-rays to cease immediately for the purpose of preventing or alleviating an escalation of danger. An inspector can also serve an enforcement notice, which requires specific corrective actions to be taken, or an inspector can pursue prosecutions. In exceptional circumstances, the EPA may revoke a license or registration. Okay, so now we are going to move on to explain how licensees and registrants can keep their authorization up to date. So you are responsible to update the EPA when changes related to how you work with ionizing radiation in your clinic occur. So it is a legal requirement to update the EPA. And how do you update them of these changes? This is the Eden portal. So Eden is a web-based portal which allows licensees and registrants to access information related to their license or certificate of registration, which is held by the EPA on its internal database. So all correspondences between the Radiation Protection Regulation team and licensees and registrants will be facilitated through Eden. So I'm going to go over the main points briefly on how to access Eden and make amendments. But if you do have any specific questions, you can contact ORP Eden support at epa.ie or contact the admin team. So if you are not currently in possession of a license or registration, then you should click the sign up button. So that's to the bottom left of the screen circled there. And then follow the relevant steps. A temporary link will be valid, which will be sent to your email. And once you click this link, that will verify your email. And once the email verification link, then you can go through back onto Eden and click the sign in button. Click the sign in button, which is on the right side, if you already currently hold a license or registration. After clicking the sign in button, click the Eden sign in and not the EPA staff sign in. If you've forgotten your password, click the blue forgot password button that I've circled there on the slide. Enter your email address and then enter the requested details. Click the reset password button and an email will be sent to the email address you have just entered. And please check your spam just in case. Click on the link from the email from Eden, and this will open a web page where you can enter a new password. And you must confirm your password and click the I'm not a robot and click reset password. And then you'll be able to see your new password reset is successful. And if you do have any more difficulty, we do have the Eden FAQ document, which I have put QR codes for throughout the last few slides of this presentation. So if you need to pay an application or an annual enforcement fee, log into Eden and then log in selecting My Authorizations under the Notify Manage section. And then in the drop-down menu on the right, select More and then select Fee Payment. And then you have the option to either pay by card or through a purchase order, and then an invoice will be sent out. Now, how to access your authorization. So click on the My Authorizations under the Notify Manage, and this will just allow you to see your authorization. But if you have made any changes to the license, or the registration, so for example, licensees who have updated their equipment inventory, then only sections of the authorization will be visible from here. So if you want to access a full copy of your full complete authorization, which includes the front cover and includes the authorization conditions, please contact the email address on the screen, so orpedensupport@epa.ie. And then just before I move on to explain how to amend your authorization, it is important to remember that licensees and registrants do not have the same requirements to store data on Eden, and therefore registrants need only make changes in Eden when there is a change of legal entity or address, a change to senior management contact or the contact for correspondence, or before carrying out a new veterinary radiology practice that's not currently covered by the existing registration. Licensees, they must also update details for their RPO, RPA, and their schedule of equipment. So how to amend your authorization. First, log in, select Amend Change Authorization under the Apply section. And then within your radiation protection authorization page, then you can make changes to your authorization by selecting the relevant tab. So this includes adding a practice, a premises, changing personnel, including senior management contacts, equipment inventory, etc. And then changes made to relevant records of your authorization will then be forwarded to the EPA for approval. So when you have gone and inputted the requirement changes, you must then navigate to the Complete tab, where you were required to input some background information into the text box and then click the Submit button. So just to note, if you're adding a new senior management contact, please remove the existing one first. There can only be one senior management contact associated with your authorization. Again, remember, go to the Complete tab and hit Submit. And again, with the Inventory tab, if you want to remove an extra equipment, for example, that you no longer use, select the Remove button at the bottom, and then you'll be asked for details about the removal. And the same if you want to add, select the Add button, and then you'll be asked for details. Again, go to the Complete tab before clicking the Submit button. And then following a site visit, you will get an email from the no reply email address to the contacts that you have put into Eden. So there will be a link that will be sent to the email of the site visit report, and site visit findings will then also be created in Eden. Again, so to view these site visit findings, under the Notify Manage, select My Authorizations. In the Notifications tab, this is where you'll find the site visits. Select the title of the site visit to respond to the EPA. So this will open up a specific site visit finding and then click Reply to the EPA at the bottom right. Supporting documentation can be uploaded with the reply along with any other required documentation, but you will need to follow each of these steps and reply to site visit findings individually. Eden users, they can fill out an online query form with a link located at the bottom of the page on Eden Ireland, and you can enter your details, including your EPA or your email address, and ensure that you select radiological protection if you're having any difficulties. You can also contact our staff directly at the ORP Eden support. And if you have any questions or queries. So on behalf of the Radiation Protection Regulation Unit of the EPA, I would like to thank all of you who have attended either one or two of the webinars we've hosted on IOR 19 in veterinary medicine. So we welcome any questions or feedback. So I would again like to highlight the email address orpedensupport@epa.ie for anything relating to your authorization or authorization application. Thank you so much for your time. So we will start the Q&A session now.